I'm Mark Golub. It's always especially wonderful to be with you for another in our JBS series, Gam Yachad, together during COVID-19. I hope all of you are doing well these days. We're heading into winter. In many parts of the country, the days are colder and shorter, and that's somewhat depressing. It'll be interesting to see how many people continue visiting outdoor restaurants. And there are reports that the number of COVID cases is rising again, though there are still far fewer deaths. Many people contracting the virus are under 50 and often don't need to be hospitalized. At the same time, hospitals seem to have learned a great deal about how to treat patients more effectively, and there are fewer hospital fatalities. But if any of you are more anxious or more depressed, or you feel like you've just had it with all the confining ways in which you must live your life, and if you're living alone, which can be the hardest of all, just know JBS is with you. I am with you. And I hope we can bring some comfort and enjoyment to you through JBS programming. Well, the state of Israel is facing its own challenges with COVID-19 these days. An increase in cases has prompted another lockdown, which has created many hardships for many Israeli families. And there's a degree of understandable social unrest. At the same time, of the more than 300,000 diagnosed cases in Israel, fewer than 2,500 Israelis have died from the virus, which is a rate of only 0.8%. And again, I want to stress the word only does not suggest that nearly 2,500 fatalities is insignificant or trivial in any way. Every person who dies from COVID-19 is someone's mother or father or husband or wife or brother or sister, dear friend, or a child. Every single death is a tragedy that changes the world. But in terms of the society as a whole and social policy that flows out of the numbers, 0.8%, lower than 1%, is a very low number. And in large measure, that number reflects the medical care Israelis receive in Israeli hospitals. And so I'm very pleased to be joined now from Israel by Dr. Dror Mevorach, who's the head of a department of internal medicine at Hadassah Hospital, who's been running Hadassah's outbreak departments. And Dror Mevorach is also affectionately known at Hadassah as the mystery solver, since he's often able to find cures for previously undiagnosed conditions. And Dror, it is wonderful having you with us. Thank you for joining us on JBS.
Great to be with you, Mark.
Thank you. Dror, before I ask you to give us a sense of how Israel is coping with COVID-19, tell us a little bit about yourself. Where were you born? In what kind of Jewish family were you raised?
I was born in Jerusalem, in the middle of Jerusalem, in a Sephardic family. I learned in Jerusalem and then studied, I was in the army, of course, and then studied medicine at the Technion in Haifa. And then I went into residency in Hadassah.
Very nice. You came from a Sephardic Jewish home, correct?
Right.
What were your parents' names?
Moshe and Rina.
And what kind of, Jewish flavor did your home have as you were growing up as a child?
Endless love from my mother and support, always behind you. My father was a little bit busy, but still there. We had a very large family in regard to cousins, and we meet in marriages and bar mitzvahs, etc.
Do you have siblings?
Do I have? I have 4, yes.
4. Very
Yes.
lovely.
So,
And
yes?
our understanding is that in Sephardic homes, there was a commitment to the Jewish tradition. Was that true of your home?
Yes, there was absolutely commitment to the Jewish tradition. This is in Jerusalem in these days. It was even kept more than today, I think. And there were a lot of relationship also with the neighbors. You know, you give them what is called mishloach manot in Purim, they give you, they like you, they know you. So there were a lot of relationship that today perhaps not everywhere you see, but at those times it was quite evident.
That's lovely. So, Dror, how would you assess the COVID threat in Israel today?
Well, today it's a good moment because we are just going out of a lockdown, which is a difficult situation perhaps to the community. However, it is very effective in reducing the numbers of infected people. And about a month ago, we arrived to 10,000 people a day verified, which means more than 1,000 people per million. The states, with its difficult situation today, never got to these numbers. It's more around 200, 300 to 250 per million. And we went up to 1,000 per million, which was first in the world.
Why do you think that was, Dror? Why do you think that was?
Well, this is very clear now, and I think we agree that the problem was a little bit going out from the first lockdown in a non-prudent way and opening all the schools and restaurants and marriages and things that all these gatherings that immediately spread again the disease.
I am constantly struck, Dror, by the way in which the medical profession has had a very hard time, it seems, getting its head around this virus. It seems that our understanding of how COVID-19 is transmitted and how best to protect oneself from the virus has changed a number of times. So I want to ask you directly. When I spoke in the past with Israeli doctors, including doctors from Hadassah, the thinking was that COVID-19 is not an airborne virus. And there was a great deal of discussion of how one should avoid contracting the disease from surfaces. Now, Dror, it seems to be the thinking is that COVID is, in fact, airborne. And it's far less likely to contract the virus from surfaces. What's your sense of this entire issue?
Yes, well, I think the world is learning. And actually, there were a lot of data at first and suggestions that surfaces are important. However, we know more and more now that it is airborne and saliva-borne when you speak, when you eat together, and it is less important. The surfaces are less important, although we should notice and we should wash our hands and use alcohol, etc. But the most important is, of course, the masks and gatherings because of that. Gatherings are very dangerous to you. And I think masks and what is called social distancing, or
Yes.
maybe we call it physical distances. I don't know why it is called social distancing,
Yes.
but it's the most important today, I think. And this is accepted by most of the experts.
Do you feel that masks protect other people from the person who's wearing a mask? Or do you also feel the mask can protect the person wearing a mask from someone else who might have COVID?
Well, it's both ways. You could argue what is more important, but it's both ways, and there are studies that show very clearly that both ways are important. Of course, if you are wearing a mask, you are more protected if you compare it to non-wearing a mask when you are near somebody who's not wearing a mask. But the best, of course, is to have both people wear masks.
Okay. I understand that you have been instrumental in the development of something called Alocetra, which has been very helpful in saving lives, especially in preventing sepsis infections. Tell us about your work.
Well, actually, my work started in New York when I was a fellow at HSS in the east side of New York, HSS Hospital, and I was studying what happened to dying cells in the body. And when I went back to Israel, I continued this research, and I developed at Hadassah a kind of a cellular treatment which consists of dying cells. And when cells die, they actually express some what we call ligands that are recognized by the immune system that swallows them, phagocytoses them, and following this swallowing, it changes the nature of the cell that swallows them. And we decided to benefit from this property and to infuse millions of cells that are in process of dying to people who are in what is called cytokine storm, and where their immune system recognize these cells, they are ingested by macrophages, which are very important mediators of the immune system. And these macrophages are becoming much more quiet, silent, non-violent, non-reactive. And we use this property in order to calm down the immune system in COVID-19 patients who are in severe and critical conditions, because they have a highly triggered immune system. And we gave it only to 8 patients by now. But what is good is that 3 of these patients were in critical conditions and 5 were in severe conditions, and all 8 recovered very nicely.
Very lovely.
We are very encouraged by that. This is a small number, of course, but we are encouraged, and we are now doing 24 patients, more 24 patients, in order to convince ourselves and the world that this is a very good medication. And you mentioned that last year we gave it to 10 patients with sepsis in Hadassah, because sepsis is another condition where what is called cytokine storm is created, this time in response to a bacteria. COVID is a virus, but also bacteria can cause cytokine storm. I hope I didn't complicate a little bit, so too much science, but
I love it. I love it. By the way, sepsis is serious infection in the body, correct?
Absolutely, yes.
And you're suggesting that your treatment can also help people with this serious infection?
Yes. What happens in sepsis is that the first treatment for people with sepsis is actually fluids in order to reconstitute the blood pressure, etc., and antibiotics. But still, if you treat them with fluids and antibiotics, still you have up to 20% mortality, 30-40% serious morbidity. And this is because the immune system is triggered abnormally. So we wanted not to suppress the immune system, but to modulate it, to make it a little bit more calmer. And the first 10 patients, we had beautiful results because they all survived. And now we are going to do a phase 2 study. This time it will be controlled. Half of the patients will get placebo, and half of the patients will get the medications. And we do hope to show that the medication is not only safe, but efficacious. I hope so.
I hope so too. I also understand you've had success in using plasma from Israelis who've recovered from COVID-19, especially among those in the Haredi community. What can you tell us about the efficacy of antibodies in plasma?
This is very interesting because, you see, these are different mechanism of action. Whereas the Alocetra, the cellular treatment that we give, is aimed to control the storm, the cytokine storm, plasma contains antibodies that can control the virus. They can actually abrogate the viral load. So we give plasma, although there are some controversies about how efficient it is. For instance, the FDA at the States approved plasma for COVID in September, about a month and a half ago. However, there are some controversies about how efficient it is, and I think it is mainly efficient for patients that are at the first stages of the disease.
And only the first stages?
Well, I think it's mainly in the first stages, unless they cannot, some patients cannot produce very well antibodies. And those patients can really benefit from any time during the disease to get plasma.
Okay.
Most of the people can produce antibodies.
Okay.
For instance, the President Trump, he got a cocktail of plasma-like antibodies, what is called hyperimmune antibodies, at the first stage of his disease, and he recovered either because of that or despite that. We don't know yet.
We don't know so much, Dror, you know.
Yes.
Dror, how soon do you think there'll be a vaccine, and is there any hope there'll be a vaccine coming out of Israel?
Well, there are more than 150 companies and universities that are trying to have a vaccine, and this is good news for us, because if there are 150 companies, I think we'll get some good vaccines out of it. There are some that are already in phase 3, like Moderna in the States, and Johnson & Johnson, and AstraZeneca, and others. The Israeli vaccine is only starting on Sunday, this coming Sunday. The first patients will be recruited and injected only in this coming Sunday. So Israel is far behind in regard to timing, because in Israel we just started phase 1, whereas a few companies are in phase 3, not talking about the Russian Sputnik 5 and the Chinese that are already given to people, although we are not sure how safe they are. So Israel for the moment is not at all at the front of this immunizations. However, we can judge only half a year from now if we see some companies that provide a good vaccine. What is important in vaccine is not only that it will be efficient, but very also safe. So
Yeah.
this combination is now examined, and I hope that in few months we'll get some, even Pfizer, I think, announced that we might get it before the elections or a little bit after the elections. I hope so.
I hope so too.
But at the same time, you have to be realistic.
Yes.
Sometimes it takes time.
Yes. So, Dror, what's your opinion of remdesivir or any other of these drugs
Yes.
that seems to help the body overcome the virus?
Yes, the most important drug that changed the treatment from April to July, August is corticosteroids. It's dexamethasone. This was a British trial called the Recovery that showed that steroids can really save lives of severe patients.
I'm sorry, what is it called?
It's called dexamethasone. It's a corticosteroid, and it is the most important drug today in COVID-19. Remdesivir was approved recently by the FDA, but it is considered only to shorten a little bit the duration of the disease. It does not reduce the mortality. It was not shown to reduce mortality, so it is considered a reasonable drug, but not more than that. It is considered to be used, although there was a WHO study that was published 10 days ago that was not sure how efficient it is, but I think it is good to use it in severe patients for 5 days in order to reduce the duration of the disease, which might be important for many people.
Dror, you also have had some strong feelings about family visiting COVID-19 patients, COVID-19 in the hospital. Tell us about your attitude.
Well, we must understand, sometimes we, the doctors, are not, willing to cure people. We are less sensitive to some psychological needs, some distressed persons that actually they are in a very bad conditions in regard to, they are not only isolated from their friends and family, they are also isolated from the medical team because we are a little bit limited. We are not there all the time. We go in for 1 hour, 2 hours. It's not that comfortable to be with this astronaut like wearing clothes. And that's why they are, I would say, alone. They are alone. So at Hadassah, in order to help that, we started doing few things. First, of course, to notice, that's the most important, and to give support to people. Next, there was a volunteer organization from what is called the Yad Avraham. That were people that were recovering from corona, from COVID-19, and they volunteered to go into the COVID-19 departments to help the people, sometimes to help them eat, sometimes to speak with them, sometimes to study a Gemara with them, all kind of activities that could ease the stay in regard to these very, very difficult conditions that people find themselves. Sometimes the disease is not that difficult as the loneliness and the being disconnected from your family and friends.
Kol hakavod to you. I think you're 1,000% correct, and I wish the medical profession understood. I hope they're all listening to you. Dror, if somebody gets COVID, the numbers show that there is a 99%, 98%, depends how old an individual is, maybe it's 95% chance that it will not be fatal. If somebody gets COVID and says to you, what are my chances of living? What do you say to them? And in general, how do you view the fear that people have about the extent to which COVID is a death sentence?
Well, I think that most of the people will recover from COVID-19 without a problem. You could see the President Donald Trump that is above 70 and recovered quite well. Most of the people will recover very nicely. Of course, if you are above 70, you are in a high risk population, and if you have some underlying diseases, also you could have some risk factors, as well as if you are obese and if you are a man. So everyone, you could dissect by its categories, by its group, to see what are the chances. But I can tell you that most people will recover nicely from COVID, although I must put a kind of asterisk here, because we don't know yet enough about the long COVID, the long-term COVID effects. We are very much familiar with the short effect, but only now we are studying again and again and understand better the long COVID effect. And some people may experience some COVID effects beyond the acute disease. So I think the question of fear, we have to explain that most people will recover very nicely. And even people that were in severe conditions, most of them will recover. However, unfortunately, some people will die, and this is estimated today about 5 times more than what is called usual flu infection, seasonal flu infection.
Dror, it is wonderful to share your insight, and I appreciate your giving us time on JBS. I hope as things move on, if there are other issues, you will let me call you again. But I wish you kol tuv v'hatzlacha both in your professional work and in your personal family life. And from time to time, I will turn to you for wisdom. Thank you so much for being with us on JBS.
Great being with you, and good evening for me. For you, it's a little bit earlier.
Thank you so much, my friend. Be well.
Bye-bye.
Be well. The insights of Dr. Dror Mevorach, head of a Department of Internal Medicine at Hadassah Hospital in Israel. I hope you've enjoyed learning from him. As always, I invite you to be in touch with me with any thoughts or comments you may have. You can email me at rabbigolub@jbstv.org. And if you have any announcement of a family nature you'd like me to make, please send those announcements to jbscommunity@jbstv.org. And so until the next time, I'm Mark Golub. Stay safe and be well, my friends.